Rhonda, over to you.
Thank you very much, Francis, for that lovely introduction. And I'd also like to thank Professor La and the organising committee for the honour of being invited to join you today. I wish it was in person, and hopefully the whole world will be able to soon meet in person again. I'd like to acknowledge first the traditional custodians of the land from which I'm joining you today here in Brisbane, Australia, who are the Jagera and the Turrbal people, and to acknowledge all the First Nations groups that are joining us today and from the lands from which everybody has come. Yesterday, I really enjoyed listening into the session from Stephanie, my colleague, who presented a wonderful introduction to INFORMAS and the food epi work. Today, we're going to be looking at food price and affordability specifically. As Stephanie said yesterday, the food price and policy action on food price is the main priority that expert groups identify when they do the food epi process. So today I'll be looking at the INFORMAS way of approaching food price and affordability to inform the policy actions that could arise from this important area. But unlike yesterday when Stephanie presented those beautiful slides and it was all polished and finished, and food epi is being used in many countries currently, the food price and affordability module is more developmental, because we're finding that these contexts really vary in different ways in different countries. And the really important data that we can find from these processes to answer specific country questions really does vary. So I'll be giving you a brief overview of food prices globally, because many of us have probably worked with food prices before, but maybe from a commodity or food security approach from a global perspective. We'll be looking much more with a health lens today, and that's what really differentiates the INFORMAS module. So I'm going to focus first on, why do we do food prices? What's the value of looking at food price and affordability? And then work through some of the challenges that there are around the definitions of what we would be measuring, how we would assess the price, looking at, do we look at just the price of foods or meals or diets? What's the most useful data to inform policy? And of course, with affordability, we need to have measures of income too. So it can be quite a complicated approach. But we've, in INFORMAS, identified 3 different levels, like Stephanie covered yesterday: the minimal approach, an expanded approach, and an optimal approach. And I'll go through and give examples of each of those, showing what policy benefits there has been from the answers to the important questions that we ask. We've got the few countries that have done food price modules listed there. And the most important thing, I think, with this presentation will be the final bit, where we start to think about what might be the best approach to measure food price and affordability in your country. And then I'm really looking forward to questions. So I understand, Francis, that I speak for about an hour and a half, and then we'll have half an hour of questions, although we might need to finish a little bit early with a little bit of a late start. So clearly there's no need for me to emphasize to this audience why we want to work in diet, so we know that unfortunately poor diet now is the #1 contributor to malnutrition in all its forms globally, and to the burden of disease, and this is highest in Africa. We really try and take a food systems approach to looking at how we might address that. So this diagram on the left explains that, you know, to do that, we're wanting to look at health and well-being, but also environmental sustainability, what's good for human health, but also planetary health, but to do that in an equitable way. So that the food affordability domain really fits in under this concept of food security. It's a really important component if we're going to improve food systems. We know we want to improve diets. For example, in Australia, if people ate according to our food-based dietary guidelines, we would have a decrease of coronary heart disease by 51%, diabetes by 34%, lung cancer by 8%, and all those other health outcomes. But we would also decrease our greenhouse gases by up to 25% too. So there's multiple reasons why we want to improve diet, and food price is one of the major barriers of that. When I was looking at what food-based dietary guidelines there might be in Africa, I found 7. I don't know if there might be more countries now that have developed food-based dietary guidelines, because this helps us answer or identify what it is that we need to cost. So food-based dietary guidelines are the key to identifying the foods and the diets that we need to price. It's important that they're done in a standardised way. So what this module does is help find alternatives if there aren't tools available, such as food-based dietary guidelines in your country. We can look at other ways of identifying what's best to price. The problem that we have is, you know, we have beautiful dietary guidelines, but less than 1% of the population follows them. So this whole module is around what are the major barriers to uptake of dietary guidelines and healthy diets in a country. In Australia, we have identified that the major problem is the quite radical change that people need to make in their diets. So this slide shows all the foods highlighted in green that people would need to eat more of, and how much more to conform to dietary guidelines, and particularly things like legumes and vegetables, and reduced fat products in some instances, just to fit enough healthy foods in our diet. But the biggest problem we have is this very high intake of what are called discretionary foods or junk foods, or different sorts of ultra processed foods, whatever we call them, they're unhealthy food options. So we've got a skew in our diets towards the unhealthier options. So you can see that looking at the food price of the healthy options versus the unhealthy options may give us greater granularity to inform policies. These radical changes we know we need to make a real comprehensive change to improve our food systems. And the challenge that we have really is that we know the solutions, we know what we need to do and how best to do that, but there's throughout the globe real barriers, a lack of political will and a lack of public demand too for improvements in our food systems and diets. And as Stephanie highlighted yesterday, INFORMAS is all about providing data, measuring food environments, because we know that if we don't measure these, they won't get talked about and they won't be seen to be a really important part of the food system. So we're looking at, you know, through INFORMAS, what are the major factors affecting food choice and the environments that drive those choice. And in this module, we're going to look at price, which most of the literature says is the #1 determinant of what people buy, what people choose to eat. I think we're getting more sophisticated about looking at other reasons, but certainly if people don't have enough money and are hungry, that's the greater driver. We're also seeing that perceived cost of healthy food can be a barrier. If people think it's more expensive to buy healthy food, they don't. The other reason we focus on food prices is you know, we know that they can be affected by very complex political, economic, social, cultural factors at the international, local, national level, and that we need to focus on the costs of habitual diet, not just selected foods. But the main reason that we focus on foods is because they are, food prices is because they can be manipulated. There's not much point in measuring an area or a metric if we can't do something about it. And food prices are manipulated basically in three major areas and at three major levels. So globally and regionally, in setting things like commodity for food floor prices or for trade agreements. And they're mostly done from a commercial commodity perspective, and not always to do with health, unfortunately. It's this second group here where national governments can do something about food prices that we need to perhaps have better data to inform policy decisions. So taxes on specific foods, so-called fat taxes, the most common one in the world at the moment is a tax on sugary drinks, and they usually advocate about 20% of increased price of sugary drinks. But there's also other approaches that countries use. There's exemption of selected goods from a GST or a value-added tax. In Australia, we're very lucky to have that. We're only one of a couple of countries in the world that have that. So in Australia, our healthy foods are 10% cheaper than the unhealthy options. But whether that's enough to drive change is something I'll look at and show you later. Also, the other way that food prices can be affected nationally is by subsidies. And these work in two ways, like subsidies as agricultural or transport subsidies that go to industry groups, or it might be voucher systems specifically targeting higher need groups or vulnerable groups. So each of these ways of changing food prices really needs quite specific data to help inform the best policy option. The other area I won't talk much about today, but I'll give you an example, is that even in some retail stores, like in-store or in-market, there has been some examples where, for marketing purposes, prices are changed. So even when things are foods are advertised as specials for loss leaders to get people to come into a shop to buy some more things, or in specific areas such as I'm working with First Nation communities, the community can decide to change the prices to make sugary drinks more expensive so that people might be choosing water. So I think it's important to keep these ways, you know, these policy objectives to the back of our mind when we're talking about how we would measure food prices. So because it does provide a lot of context, I just wanted to talk a little bit about global food price monitoring. As I've said, mostly this is done in an economic context, and it's influenced by things like climate or weather or international oil prices, market speculation, pandemics. Of course, at the moment, we're seeing huge swings with food price internationally. But from a health perspective, there really is little focus on the different commodity groups, and the data also tends to be very highly aggregated. So it doesn't give us particularly valuable data. It might be contextualized. These are examples of major global food price indicators. You might have used some of them in your work. Some of them are more useful for health because they're contextualized for local conditions, etc. But such as the World Food Programme's FERN price data store, but they still tend to be focused on commodity groups and on food as a quantity rather than the quality of food that we need to inform more specific health processes. At a regional and national level, there's actually surprisingly few comprehensive food price data sets available. So one of the most widely known one is the US Department of Agriculture Center for policy, nutrition policy and promotion data, and I'll be showing you how that's been used in another slide coming up. But also there's some specifics done. For example, there's stressor monitoring, such as looking at how to assess the price changes due to COVID at the moment, and you can find some regional databases on those. The challenge is that they're often collected by very different methods, and it's difficult to compare across different regions, and there's also different ways that they're analysed and reported too. One example of a common regional or country indicator is the consumer price index of food. Now, not all countries collect this. They often collect consumer price index, which is used as a measure of inflation. So where there is greater granularity and all the different compartments that are used to identify change in food over time are considered, you can identify sometimes the component that's due to food and beverage change. And the two main methods that's developed from is household consumption data or expenditure from national accounts. So they give you the approximate change over time in the current diet. Now, if you think back at the first slides I show you, one thing we're conscious of globally is our current diet is not healthy. It's the unhealthy diet. So really, if we're looking to inform policy, we want to go from the current situation that isn't the best for our health to a healthy diet. So we also need to have CPI for just healthy foods. And in Australia, we've been able to convince the Bureau of Statistics to do that once, and it provided incredibly valuable information. So if we could get all countries assessing the consumer price index of healthy foods, we wouldn't need this INFORMAS module. And that's one of my ultimate goals, is to put ourselves out of business in this area. There are some other national indicators that are used. For example, the World Bank uses a basket of 1,200 kilocalories, the price of that in different countries, to set the world food poverty line. One sort of semi-serious approach that's used to look at purchasing power parity is the Big Mac Index. How much does it cost to buy a McDonald's hamburger in your country? And I don't know how many of your countries even have McDonald's hamburgers. One of the things that we're finding is that the price of McDonald's hamburgers, even in our own country, does vary quite a lot. So it's a bit of a myth that they might be the same in each country. But it gives you an idea of how we really do need to have a feel for how different countries may compare in food prices relative to the income of different groups. There's been very many approaches to measure the cost of selected lists of healthy foods and unhealthy foods, and the cost of a current or a healthy diet, but often they're not based on any real data such as dietary guidelines. But very rarely has there been studies that looked at the price of healthy and current and unhealthy meals, or the differential between what people are currently eating in their diet and what they should be eating based on those, three metrics: healthy, sustainable, and equitable. Sorry about my cat there trying to join in. When we established INFORMAS in 2013, there was no studies that had assessed the cost differential between current and healthy diets. There's been quite a few since then, and I'll show you some of those results in this presentation. One thing that it's really important to understand when we look at food price is that you really need to think very clearly about the way the data is presented and what's actually being measured. So there's a very common theory about the economics of food choice that says healthy foods are much more expensive than unhealthy foods. often they've been developed by costing how much. If you see here, that's the energy density on the y-axis, and then the cost of the food here on the x-axis. And this is from Aboriginal communities in Australia, and it was used to demonstrate that the costs of foods, healthy foods like meat, vegetables, fruit, eggs, etc., are much more expensive than the cost of unhealthy foods like margarine or sugar or oil. But for those of you who have done statistics, you'll see there's an immediate problem here, that we've got both on the X and Y axis, the kilojoules. So these two domains, these two axes are actually related. So the data is quite spurious due to the statistical coupling, and you get into this idea of circular reasoning. So it's very important when you're looking at food data, because this is so commonly done, to just check that there's not the same unit on each of the axes of the data that you're looking at, because it's no wonder that we see an association when those metrics are considered in each of the algorithms on the X and Y axis. So please check that out. Andrea Carlson and Elizabeth Frizzell actually took investigation into this common statistical error a little bit further, and they costed that whole US database and presented the data in whether the different food groups were presented as the cost per 100 calories, so per energy, or the cost per grams of the food, or the cost of the average portion. And they found very different results. For example, if you just look at the cost of food per energy, vegetables, because they're so low in energy density, are very, very expensive. But if you look at the cost of vegetables per grams, they're actually a lot cheaper relative to other foods, and the same for average portion. But other foods, like for example, protein foods, are most expensive per gram, but relatively less expensive when you look per 100 calories. So they were able to really show that the cost of foods is different. And they found that in the US, it was less costly to meet dietary recommendations for grain products, for dairy foods and fruit than for vegetables or protein foods like meat, poultry and fish foods on average across all those domains. And there's actually been another systematic review by Rao et al. That found that healthier diet patterns were more expensive on average, but in fact, they were only in the United States $1.50 more expensive than the less healthy option per day. So that was only something like 10% of the diet less expensive. So it's really important to understand what units you wish to report on. And some of the results that are in the literature are not surprising, because we keep getting the same mostly around the world. So what people have done often is to assess choose a particular food in a food group. So say if you're looking at meat and alternatives, the less healthy food might be fatty red meat or fatty sausages. And then they match that up with a healthier food. But the challenge here is, what foods would you use to match? Like, is the healthier alternative for fatty red meat just trimmed meat? You cut all the fat off. Or is it something more if you consider the planetary diet, like nuts and pulses and legumes? Is that the better alternative for fatty meat? Or is it fish? So you can see there's, for each of these pairs, there's a number of options. Now, lean meat is very, very expensive, as we've just seen, per unit, per weight and per serve. It's very, very expensive. But something like legumes and nuts and seeds are relatively more affordable. So what people match the different foods with is really important. So I tried to find some African examples in the literature that showed food pairs, and I really couldn't find any. So I'm hoping there's some people online that have tried to do this previously and will be able to provide some insights to the group generally. But maybe this is one of the questions we need to ask when we get to the end session about what approach would suit your country best. Would this be possible to do? Sometimes it's very obvious. For example, if you've got sugary drinks, you might compare the cost of diet drinks or, you know, drinks that have got artificial sweetener in them, but you could actually just compare it with water. And would that be water that people buy in a bottle, or would it be water from a tap? So you can see how all these choices really make a big difference. The same with foods and healthy meals. You know, what's the alternative to an unhealthy fried chicken and chip meal? Would it be grilled chicken and potatoes, or would it be something completely different, like a homemade curry or some food from your own traditional culture? So for each of those areas, when you're matching healthy food and unhealthy food, you have to think, well, what foods and amounts? Is there a particular brand if there are commercially available foods? Are both of the pairs equitable? Like some might be much more available and more accessible and more acceptable than other foods to different groups. Are they both equal sustainability? Are they both culturally appropriate? Are the healthier meals really healthy? I remember the first time I was asked to do this, I had to compare, I was given some lists, the difference between the cost of tinned meat that was in water or tinned meat that had salt added to it. But in fact, both of those foods were relatively healthy compared to the habitual diet. So it's really hard to compare across the different categories as well as within the pairs. Then the question based from Frazell and Carlson's study, should the meals have the same energy content or weight or serves? Whatever answer you make to these will really affect the results that you get. When we start talking about food prices too, a common question that people say is, well, what about the costs that you need to procure the food? So if you're producing food at home, the fertilizer, your time, the tools and equipment that you need to grow the food, or if you're buying it at the market to transport, what about the costs of storage, preparation, cooking, the stoves, the energy used for the heat source? You need to have cooking pots, plates and utensils, washing equipment. You know, do we include all these costs when we're looking about the costs of a diet too? You might have different views about whether that should be included or not. The other challenge when we're looking at affordability of foods is that we also need to consider income. So affordability it's got two metrics: the cost of the food, but how much money people have to buy it. And this is not commonly considered when people are looking at food prices. But in low and middle income families, on average, the proportion of gross income spent on food is up to 80% in some low income families, but less, of course, in middle class households. But in high income countries, it can be quite different. For example, up to only 40% for those with low income in America, where food prices are relatively cheap. The challenge is, how do you measure income from a family? Do you look at median disposable household income? That would be ideal, but a lot of countries, including Australia, only produce gross income to measure from a table. But also you might want to look at particular incomes for low income groups, where you might want to factor in any welfare payments or any food supplements that they get as a bonus as well. So many different factors that affect the method that you would use to determine income. And then in the same way that there's different ways that policy can be used to affect food prices, there's many different policy approaches, both fiscal and economic, that affect household income. So some of these are, taxation policies I talked about before, or supplements or subsidies or remote allowances. A lot of countries, of course, have none of these, apart from tax. So it's really important before you do food prices that you look at the context, identify what current policies actually affect affordability of food now, and then consider, when we get the answers to these important research questions we're going to interrogate, do they provide evidence that we need to advocate for change of those policies to make healthy food more affordable for the most vulnerable? This is an example of how FAO data has been used to identify the costs of food. So this is the price of food all around the world, the proportion of household expenditure on food. So in Africa, they're saying the average is greater than 50%, and in some parts of Southeast Asia too. But in other countries like North America and Australia, it's up less than 25%. My question here, though, is the food in these baskets really healthy, sustainable, or fair? Some of the food in African countries can be, mainly grain and very little variety and very poor nutritional quality. So it's not really comparing similar diets, similar healthy, sustainable, and equitable diets around the world. Those two components of affordability and income and food price are being considered in different ways. So that's where INFORMAS started looking at, what is being measured in food environments and what is being monitored. So we looked at the WHO Global Monitoring Framework, and there's really only 2 food environment metrics that are part of that regular data collection. One is marketing to children of foods, and the other is policies to limit saturated fat and trans fat in the diet. So INFORMAS looks at the other components of food environments, and it's here that you can see. Stephanie talked yesterday about food epi, which is part of the processes of the INFORMAS assessment. But here are the different impacts, like food composition, food marketing, food provision, which Stephanie talked about yesterday. And here we're focusing specifically on food prices. So if we look at all those factors that I've considered, the main question that we really want to ask, because always with research, the most important thing is getting the question right, isn't it? Is what are the price differential, and the affordability of healthy and current, which are unhealthy, habitual diets? And how would those metrics change under different fiscal and health policy scenarios? And what would be the health and economic outcomes of that? So the next part of the presentation will look at the standard way that INFORMAS was recommending a minimal, expanded, and optimal approach to answer those questions. Here I'd like to acknowledge the wonderful work of our colleague, Sally Mackay from the University of Auckland. Sally's done some work in her PhD, awarded 3 or 4 years ago now. She's Dr. Mackay, around the different approaches to the minimal approach. So the pairs approach I've already talked about a little bit because it is commonly used throughout several countries, looking at the cost of the pairs of healthy and unhealthy foods. The challenge is, as I've said, these are measured in different ways. And sometimes what the list will do is look at similar items with a difference in nutrient content. But from that example that I used with salt, you know, we're mainly worried about sugar, or we're mainly worried about fat, or we're worried about salt. You know, people choose foods on the basis of them being whole foods, rather than go and choose foods on the basis of their nutrient content. So it can be a little bit reductionist to try to classify the way that we would identify healthy and unhealthy foods on the basis of their formulation in nutrients. What we need to do with the minimal approach is make sure that we've got data that will allow us to assess the price changes over time, because there's a problem in looking at the differential. As we've talked about, it depends very much on the food you choose. So having a standard approach that's measured over time is the most important thing. And one of the things that Sally did was use the NOVA framework to identify healthy and unhealthy foods on the basis of their degree of processing. And she achieved some very interesting results doing that. So when she chose food pairs, she identified all those issues we've talked about already, and this problem about what nutrients do you privilege when you're looking at the difference between the nutrient profiling of foods, and how would you match foods. But she also characterised the different data sources of food prices that you could use. So once you've got the list, you might be able to collect the food prices in markets or in supermarkets or in corner stores, wherever people are buying food. You might want to access the consumer price index data of your own country if you collect that data and if it's available. Another approach that's been used is using home scan panels. So these can be quite expensive though, looking at the Nielsen food data available globally, or Kantar food panel data, where the food prices are collected commercially and you can purchase those. Or you might want to look at those rare occasions, like I said, in the US, where there's good national food price databases available. And there's advantages and disadvantages of adopting each of those approach. I won't go through them. It's really more that if people are interested in looking at food prices, you could go back to the slides that will be available to help to consider to identify the issues that are important to consider. So I want to provide a few examples of the INFORMAS responses and results now. So Sally's approach at adopting minimal approach over time. She developed a food price index where she looked at a representative food basket of commonly consumed foods. And then she accessed the prices. She selected the foods, based on the expenditure in the Household Economic Survey. And then she used Statistics NT. They collected the food prices from different regions and different types of shop. And in fact, in New Zealand, they report those prices monthly. So it meant that she could look at the changes of those prices over time. So this is an example of the data from Statistics NZ in New Zealand. So there may be access to similar data in your country, maybe not reported every monthly, but every year. Some countries do keep an idea of how food prices are going to work out consumer price index, and also for some trade issues. What Sally found over time, going right back to 2007, is that both the healthier foods and the less healthy foods increased in price over time. And they did that at a fairly similar rate. So she found that the less healthy foods were actually more expensive. So that was different than the assumption that healthier foods are more expensive. But the difference between them didn't change over time. But when she looked at, these are the NOVA categories, the processed food over time increased, the minimally processed, this non-hashed line here increased over time, but ultra-processed foods over time actually became cheaper. So it could be that the very worst unhealthy foods are the ones that are becoming cheaper. So it could just be an artifact of the way we classify foods that suggests that healthy foods are actually cheaper than other foods. Then we can go on and look at the expanded approach. So if your country has food-based dietary guidelines, or if you've done any modelling about translating commonly available foods into diets, you may be able to look at this approach. What this approach does is actually just anchor those food lists. So instead of worrying about, do I choose kilojoules or weight or serves of foods, it says, let's look in a real-time scenario at the cost of a diet, what people are currently eating, and the average diet, very hard and very big standard errors looking at average diet in a country, but let's just presume we've got an average diet, and that's the current unhealthy diet, and model what that would look like if we move to a healthier diet. So often people can do this by just substituting those healthier meal plans for the current foods. So long as you develop a tool that you use regularly, it can be used for monitoring purpose. And then we can transcribe those diets into lists that are ready for pricing in the same way as the minimal approach, using those different data sets. Then the optimal approach is using the expanded approach, but bringing in that concept of household income. So in INFORMAS, the two ways that we do this is accessing the median disposable household income, but also developing income measures for low socioeconomic groups. So that can be based on scenario modelling, you know, working out if people are unemployed, how much money are they likely to have in that household for a 2-week period. This graph shows the gross median household income in different parts of the world. So the data is available for people to draw from. What I want to do now is, you know, we've been talking a lot about methods and it's all a little bit nebulous, but want to draw from some other examples. So I've shown you Sally's examples of looking at the minimal diets. Here we'll be looking at our experience in developing optimum diets. So I've got 3 different ways that that's been done. The first way, I want to talk about what we call Healthy Diets ASAP, the Australian Standardised Affordability and Pricing methods. Now, these methods can be used and replicated in other countries. So Sally's used them again in New Zealand too. But I'll just talk about what we found in Australia, and importantly, the 4 different ways that this data has helped to improve policy in food prices in Australia. So we started looking at what Australians were doing, what different groups were doing to measure food prices. And we found in a systematic review that there was 5 major but 6 minor methods where people were going out, different groups were going out, measuring the cost of different healthier diets, not a current diet, not a healthy diet, but
sorry, Amanda.
Yes.
Sorry, Amanda. Just 1 second. So there's confusion here. So interpreter, please, Guy, please, can you choose the right channel? The English channel is transmitting French, and it may be confusion to participants. Sorry about that. So, Guy, please choose the right channel. Please continue, Amanda. Sorry.
Okay, that's all right. I'm pleased to know I've been speaking French all the time. So, you know, it's important to look at what work's being done in your country before you start looking at a systematic way of doing it, because it might be that one of these approaches is suitable for broader application. But in Australia, when we found these different approaches that were being used, we looked at what the findings were and if they had ever been used to inform policy. So for 20 years, these surveys were happening regularly, but all we found is that food prices were more expensive in rural and remote areas than in major cities. There was no significant difference in different disadvantaged areas of disadvantage. We found, like Sally, that prices increase over time. Unless you're in a recession, that's not surprising, is it? And we found that affordability of food over time, of healthy food, was relatively consistent. So between 25 to 40% of household income, depending on the household income. And that this gave us an idea that affordability was about 30% of income. But results had not been used once in those 20 years to inform policy. We just kept measuring and everyone say, oh yes, look, we found what we'd expect. And they were never used to inform policy. So that's a waste of all our time to do that. We really needed to think what's going to inform policy. So the process we did was develop a protocol based on the INFORMAS approach where we would assess what's the current diet, what are Australians currently eating from our National Health Survey. We worked out for a family of 2 adults and 2 children what that would be per fortnight. And then we worked out what that would be if they ate a minimal change to have a diet consistent with our food-based dietary guidelines. And then the most important thing was that we had a series of meetings with stakeholders. We needed everyone across the country to agree that the approach that we would do would be what they would use so that we could have comparable and standardized data for the first time. So these are the standardized diet pricing tool. The current diet and the healthy diet were similar in energy, but not surprising. The healthy diet was slightly a little bit less, and that's consistent with what we're seeing in Australia, where we're all getting fatter. Our BMI on average is increasing, and you don't need that much extra kilojoules per year for consumption on average for your BMI to go up. But we wanted to have people move towards a healthy recommended diet, but there really wasn't that much difference in kilojoule. This is the picture of what a household of 4 would consume in Australia per fortnight. Now you might want to start thinking, what would this photo look like for your country? I know there's been some wonderful books that have printed photos of the average intake in different countries. But thinking about identifying these foods from national surveys is really important first approach. So basically for Australia, you can see all these foods over here are the unhealthy foods. So we were really surprised when you picture this. It's a good nutrition education tool anyway, because people are quite shocked to see all these unhealthy foods. And then we took a photo of what a healthier diet would be that was more equitable, would have less water use, greater biodiversity input, decrease greenhouse gas emission by 25%, and just slightly less kilojoules, but more food. You know, the bulk of the previous slide was taken up by all the packaging. So you can actually have more weight of food, but less kilojoules. And we costed those foods. We go into supermarkets and into the different food stores. We have a web-based food price data collection tool now, so you can just collect it on your phone or the prices on iPad, and then we take that back to our office. We've got standardized price collection protocols because, you know, when you're going into a store, you do take a big packet or a small packet of the food. So you have to, all of those metrics have to be spelled out, and there has to be rules so that the same process is followed every time. We have a way of randomly selecting which areas we survey in and which stores we would survey in. And we have also standardized methods to estimate the household income, so they're comparable. And that's the different stores. And then importantly, in our computer program, it took a while to set up, maybe 2 or 3 months, but we have this wonderful button here called Calculate. And when you've entered all the food prices for the right foods, we press that button and it produces spreadsheets of the data that converts the data into graphical outcomes. And I'll explain what those figures mean from this one result. So this is looking at socioeconomic quintile 3 in Sydney. This bar on the left is the cost of the current diet at that time. All the different colours represent the different food groups. So these bluey green colours are different healthy food groups from the dietary guideline recommendation. Anything coloured red is the unhealthy food options, such as takeaway foods, all those foods on the left-hand side in the picture. And then this is the cost of the healthy diet. So basically it's the same foods that Australians are eating, but more quantities as per that second picture. And what this data showed us is surprisingly that a healthy diet would be cheaper than a current diet. We were very surprised by that. We didn't expect that to be the case. The main reason that occurs in Australia is because these foods are exempt from goods and service tax. But even with 10% goods and service tax, it was a little bit cheaper to buy the current healthy diet. The other thing we were surprised about is, look at all this red. We found that Australians were spending 58% of the family food budget on the unhealthy foods. Now, it took us 2 years to get this paper published because the editors kept saying, you must have made a mistake. That wouldn't be possible for people to spend that much of their food dollar on unhealthy foods. But we worked with the Australian Bureau of Statistics, and as I said before, they worked out consumer price index for healthy foods that same year, and they found that using a different method based on household food expenditure consumption, that the figure they got was 58.2%. So we were very confident through that triangulation that this was actually correct. Then we found that, like, if you look at affordability, less than 30% low-income households, or food stress, less than 25% of low-income households, even though it was cheaper to buy the healthy foods, that was still not affordable for low-income groups and still cause food stress. So we started then thinking, well, price is important, but why are people buying the unhealthy foods if they're more expensive? And it started us to think about the other INFORMAS domains. Those other unhealthy foods are the ones that are most advertised. They're most available. They're used for entertainment. They're the foods that are high in sugar and salt and fat. So people have taste for them, and they're also most convenient. So maybe people are buying all those foods so that they don't have to cook, they don't have to buy all the extra cooking pots and things that we talked about before. But it starts to inform what we can do with food price policy. We've measured now food prices in many different areas of Australia, and we found it doesn't really matter. This axis here is socioeconomic area. It doesn't really matter which socioeconomic area people in. The major driver of food choice is this remote areas. So if people live a long way from the cities, they pay a lot more for both their current diet that's shown in red and the healthy diet in green. So we've been able to use this data to advocate for transport subsidies for food to these remote areas. We've also been able to measure intake of foods in remote areas and found that in this area, we can compare with the capital cities now for the first time. People, if they swap to a healthier diet where there's been changes in cross-subsidisation of food price in store, so in this community, the remote store made the food prices the same price as in Alice Springs for the healthy food. So this is for the closest regional centre. So all the healthy foods are the same price, but they put up the cost of the unhealthy options in that store. And people saved $105 a fortnight buying the healthier food. But for some people, it was still unaffordable to do that. Not because the food prices were more expensive, but because their income was so low. So we had real data to say, look, the major problem in these areas is poverty, and we need to work to increase the welfare subsidies that people were getting in this community, or we need to work to make more real jobs and focus on employment in this area. So again, that was used to inform policy. Is there a question?
No, I think it's yes, an interruption.
Okay.
So we'll miss the participant. Sorry about that.
No, that's all right. I'll just keep going for a bit because this has been the most effective way that every few years our government says that they want to do what they call expand the base of the goods and service tax in Australia. And that means for them to start taxing healthy foods. We keep fighting. We won that 20 years ago, but every year we keep on having to fight to keep that exemption of the basic healthy foods. So for the first time, a few years ago when there was a tax discussion paper, we were able to say, if we increase the goods and service base to include basic healthy foods, healthy diets will cost $60 more per fortnight. And current diets will cost $30 more per fortnight, but the most important, the foods that increase most are the green foods or the healthy foods. The unhealthy foods don't increase much in price at all. But if we extend that GST base to increase the level of the GST from 10% to 15%, it works like a fat tax and it puts up the cost of the unhealthy food in the current diet. And it would even be better if we increased our GST to 20%, so around the cost extra that people are talking about with sugary drinks. If we increase the GST to 20%, that would actually relatively increase the current diet costs more and drive people to start consuming the healthier diet. Because if people aren't consuming the healthier diet and it's already cheaper, we don't want to put any more barriers in the way to stop them choosing healthy food. And, you know, this worked. They did not extend the GST base to basic healthy foods in Australia. So we were really happy about that. So this data has been used now 4 times to inform policy. One other time, this slide's a bit complicated, but it shows, if you just look at these 2 bars on the left, at the cost of a healthy diet and the affordability, looking before COVID, which are the blue dots, for unemployed people and for people on minimum wage. The healthy diet was quite expensive, but not as unaffordable as the current diet. But when our government introduced supplements for coronavirus and increased people's income, both diets became more affordable. So healthy diets are much more affordable now. And data from our social security services show that about 80% of this extra income that was coming into households was spent on healthy food. So we're using that now to argue to keep those supplements going until the end of the pandemic at least. So there's many limitations of this approach. I won't go through them all, but I hope I've given you a taste of some of the benefits of looking at this INFORMAS way of measuring the cost and affordability of healthy and unhealthy diets. So you need to have good dietary data, and you need to have food-based dietary guidelines to do what I've just shown you we were able to do. New Zealand had dietary data, but they only had nutrient data. They didn't have food data. So our colleague, Sally Mackay, had worked out a way to be able to model the cost differential between the the healthy and the current less healthy diets. And because New Zealand is even 3 hours ahead of us, Sally recorded her presentation for you. And I'd like to play that now, and she'll explain the approach that New Zealand took, which is called diet cost. And this has also been used in some other countries. So let's hope that this video works.
Kia ora koutou. I'm Dr. Sally Mackay from the University of Auckland in New Zealand, and I'm going to give you a very brief overview of the Diet Cost Program. This is a computer modelling program that was developed by a research team at the University of Auckland, and it was led by Dr. Stephanie van der Veer here, who's also presenting at this workshop. So as you know, the cost of food is a major determinant of food choices. And there is also more than one healthy diet. You can, if you've got, say, 50 healthy foods, you can combine them in different ways and come up with different healthy diets. So the variation of the cost of diets is important. And costing more than one menu plan allows for statistical comparisons, particularly between a healthy diet and a current diet. We've also recently added flexitarian and vegan diets to assess the sustainability of diets as well. So you can go to the INFORMAS website, and there is a manual about the Diet Cost Program if you want to know more about it and how it works. And you can also get the link to the Diet Cost Program from the INFORMAS website. There is a publication available if you want to know more about the methods and the results. And as I said, sustainability was added recently by a master's student, Bruce Kidd. So behind the modelling program, there's 6 sort of Excel spreadsheets with different workbooks. And so you can see they're outlined here. So the first one is the common foods. So this is, say the most 100 common foods in your country. So the spreadsheets are adapted for the different countries as long as the column headings stay the same. Then we extract data from a food composition database so that we've got the major nutrients there. There are nutrient targets for each of the 4 household members that makes up the household. So, for example, the energy required for a healthy diet for an adult man, and then the energy that's typically consumed by an adult. So that's for the current diet. Then there's food constraints, so that we don't have too much of a particular food in the diet. because the diets, the menu plans are put together by the computer, not by a person, there needs to be some constraints, or you might end up with, you know, a kilogram of apples a day, which is not possible. Then the food prices are there, and also the emissions data for each of those common foods. So then there's an interface on the website where there's, you can choose from the 4 household members, and you can choose one of the 4 diet types. There are food group targets that you can adjust on the interface, and also some of the nutrients. Then the program in the background looks for successful meal plans, which are then displayed and downloaded. And the program also combines the household members so that you have a combined output on the screen. So I'll just briefly show you what the interface looks like. So for example, you can see up here, this is where you can choose the one of 4 household members and one of 4 diet types. So that C stands for the current diet. You can move these sliders to adjust the nutrients. And you can also move the sliders, for example, the number of serves of vegetables per day. You then download the meal plans, combine the members for the together for household menu plans. So that's an example.
Amanda, we can hear Sally, but we can't see. So let me try it from here. Don't worry. Let me try it from here. Let's see.
Okay. Thank you very much.
Sorry.
Plans, and you'll see that they differ in the amount.
Would you like me to stop showing the?
Yes, so you can stop
Yes.
sharing your screen, and let me try from here.
Okay.
Hi Koto, I'm Dr. Sally Mackay from the University of Auckland in New Zealand, and I'm going to give you a very brief.
Is that working?
Is that working? Is it working?
This is a computer modelling program that was developed by a research team at the University.
No, it's not working.
Okay, one
by
second.
Dr. Stefan van der Veer.
Yeah, it's working.
This,
It's not working, right?
It's working.
It's working. Okay.
Yes, it's working.
Thank you.
So as you
Yeah,
know,
it's
this
working
is
for me.
of food choices. And there is also more than one healthy diet. You can, if you've got, say, 50 healthy foods, you can combine them in different ways and come up with different healthy diets. So the variation of the cost of diets is important. And costing more than one menu plan allows for statistical comparisons, particularly between a healthy diet and a current diet. We've also recently added flexitarian and vegan diets to assess the sustainability of diets as well. So you can go to the INFORMAS website, and there is a manual about the diet cost program if you want to know more about it and how it works. And you can also get the link to the diet cost program from the INFORMAS website. There is a publication available if you want to know more about the methods and the results. And as I said, sustainability was added recently by a master's student, Bruce Kidd. So behind the modelling program, there's 6 sort of Excel spreadsheets with different workbooks. And so you can see they're outlined here. So the first one is the common foods. So this is, you know, say the most 100 common foods in your country. So the spreadsheets are adapted for the different countries as long as the column headings stay the same. Then we extract data from a food composition database so that we've got the major nutrients there. There are nutrient targets for each of the 4 household members that makes up the household. So for example, the energy required for a healthy diet for an adult man, and then the energy that's typically consumed by an adult. So that's for the current diet. Then there's food constraints, so that we don't have too much of a particular food in the diet, because the diets, the menu plans are put together by the computer, not by a person. There needs to be some constraints, or you might end up with, you know, a kilogram of apples a day, which is not possible. Then the food prices are there, and also the emissions data for each of those common foods. So then there's an interface on the website where there's, you can choose from the 4 household members, and you can choose one of the 4 diet types. There are food group targets that you can adjust on the interface, and also some of the nutrients. Then the program in the background looks for successful meal plans, which are then displayed and downloaded. And the program also combines the household members so that you have a combined output on the screen. So I'll just briefly show you what the interface looks like. So for example, you can see up here, this is where you can choose one of 4 household members and one of 4 diet types. So that C stands for the current diet. You can move these sliders to adjust the nutrients. And you can also move the sliders, for example, the number of serves of vegetables per day. You then download the meal plans, combine the members together for household menu plans. So that's an example of some combined statistics here of price range. And you can also get the results broken down by food group. So this is just an example of the beginning of a couple of meal plans that are visible on the interface. So they're both healthy eating plans, and you'll see that they differ in the amount of each food. They have the same foods, but they differ in the amounts because different combinations can still have healthy eating plans. And then you also get this emissions breakdown as well. So overall, and then by the individual bits, so transport, farming and processing, etc. Then you get the household results. So you get a price range here and a standard deviation and confidence intervals. And then you get, so this is an example of the food group breakdown, but you also get the individual foods as well. So briefly, some summary results for New Zealand. So this is from a few years ago. So you can see for each of the household members, there was a certain number of meal plans that were successful. And then these were combined to get a lot of meal plans. And then you have the average cost of the diet, the range, etc. This is the results graphically shown for when we also included the flexitarian and the vegan diet. So not surprisingly, you can see that the current diet had a higher climate impact than the vegan and the flexitarian diet, but was also cheaper than those diets. So that was a really interesting finding for us. The limitations are you do need to prepare the Excel files. That doesn't happen magically. The menus are built by the computer program rather than put together by a person, so they don't come out like breakfast, lunch and dinner. You need to sort of check through a selection of them to make sure they are feasible. And the menu plans for individual household members are constructed independently, whereas in reality, you would make a meal plan for a household and then adjust it for the different members. And of course, the program is only as good as the data that you put in. So you do need some good nutrition survey data to get those common foods. You need good prices data. And if you're looking at sustainability, you also need the emissions data. So if you have any questions about this, please feel free to contact me or have a look on the INFORMAS website. So I hope you enjoy the rest of the workshop. Goodbye.
Wonderful presentation by Sally. Amanda, how many more slides do you have?
I have got 4 slides that Stephanie van der Vera may wish to speak on, and then just 2 slides at the end. So we're pretty.
Okay.
Now. Okay.
We need that material, so we'll make room for you to do that. Please go ahead.
So Stephanie, if Stephanie is here, Stephanie, would you like me to put on your 4 slides and you can talk to those?
Yeah, I mean, I could do that, yes.
Yeah, how about I share the screen and we go, and it's just the slides that you had sent.
Although I think I can do that quite quickly as well. I think it's just...
Look, if you don't mind, I'll do it from here because otherwise it'll just delay things when I go to the 2 final slides.
Yeah, that's fine.
You tell me when you want me to move in them and I'll move them for you.
Yeah. So this is also, we applied the optimal approach in Belgium with our national dietary survey data, although the data from the survey are from 2014-15. And so we used also GfK or Kantar data, so the prices over 1 year of foods. And then we merged that with foods consumed in the nutrition survey. So we had a representative prices database over the year and also representative prices data. And then we basically looked at, you can actually move the slide, Amanda. We looked at the dietary share of ultra-processed foods as well as minimally processed foods. So Amanda spoke to that for the minimal approach as well. So that's a classification which looks at the extent and purpose of food processing. And so you get a dietary indicator, which is really giving you the share in the diet of ultra-processed foods. So the proportion of energy that is consumed from ultra-processed foods or minimally processed foods. Yes, you can move the slides. So we did look at whether diets that contain higher or lower levels of ultra-processed food products were cheaper or more expensive in Belgium. So that can also be different in different countries. It's a context-specific study. So we basically looked at the tertiles of the proportion of energy from ultra-processed and minimally processed food. So these slides just show you consumption data on the proportion of energy that different population groups consume from ultra-processed food. So in Belgium, we are nowhere near the levels that we see, for example, in the UK or the US, which nears 50%. So we see that it's about 30% of the energy in the diet that is coming from ultra-processed foods, a bit higher in children than in the other groups. And then for minimally processed foods, we do see differences between higher and lower socioeconomic groups, but not for ultra-processed foods. So yes, you can move to the next slide. And so maybe I'm just gonna be quick. So what we did find is that diets with a higher contribution, so energy contribution of ultra-processed foods are significantly cheaper than diets with a lower proportion of these foods. And then we found the opposite for the contribution of unprocessed and minimally processed foods. So I guess what this study adds is just using another indicator. So looking at NOVA and the contribution that these highly processed foods have in the diet, and whether people who consume more of these foods, the cost of the diet, whether it's lower or higher. So it's another way of looking at defining healthy diets. So I think that's just another example of the optimal approach. And also, since we only used prices data from Kantar, this wasn't all that expensive. If you would buy sales data, it would be very expensive, but I think we got a reasonable, so I mean, it's feasible, I think, to do this and to get representative prices data and to try to link that with your nutrition survey data, if these data on prices are available, because it's not as expensive as using, I mean, sales data, which would be really expensive to buy. So yes, I think that's it, Mandy.
Oh, thanks very much, Stephanie. That's great to have you explain those. And I just find it amazing that, you know, your data showed that the unhealthier diets were actually cheaper. So it could be that, you know, like Sally's early data showed that ultra-processed foods were actually the cheapest sort of processed foods. So it just shows with additional granularity you might be able to get more valuable data too. Yeah. So just very quickly, I won't go into these in any details, but the other countries that have looked at the food price module have all used different approaches. And I think we're starting to realise that this is going to be more context specific, because there's going to be particular foods, particular databases, particular ways that food prices or household income data need to be identified. And there's different policy questions being asked around food prices in different places. So Argentina and Mexico have both used the optimal approach. Most of these approaches have been submitted for publication, although the Mexican data is not yet published. Brazil has used more a food-based approach, so looking at minimal approach, but have used the ultra-processed food and NOVA approach, and have produced 3 papers that are very useful, again showing that the diets that are higher in ultra-processed foods are cheaper in those places, so identifying that maybe there's scope for fat taxes and other approaches to increase their price and try to drive the environment in pricing more towards the healthier options. So really that's all that I was going to cover today. I think the most important thing is that I hope that some of these approaches and insights have helped to you to frame questions about what you would need to do, what data you would need to do, what contextual analysis you might need to do before doing food prices in your own country. But I also hope that the applications of the data have helped see how, importantly, the results can be used to drive improved policy, to improve price parity of healthy and unhealthy diets in your own community. So, you know, these are the real questions that we need to answer before deciding what approach might be able to be done. I've actually put these in a couple of slides, the key questions to help frame the approach that you might take. And to identify what's needed if you wanted to do the optimal approach. But as you can see, even from Stephanie's last slides, like you didn't look at affordability, Stephanie, in that study, because that wasn't really the purpose of it. So, there's a range of different endpoints in the approaches that are taken here, and it doesn't matter so long as it's relevant for your own policy question. So, you know, some of the contextual information is, do you have data on the dietary habits and food preferences of the population? Do people grow their own food? Where do they buy the food? Do people eat out? Do you need to consider restaurants and takeouts and those other sources of foods? What factors are in places already in your countries around food prices? Does your country have a food and nutrition policy that considers these issues? And then looking at things like, you know, do you know what people eat? And then what about different ages and genders, socioeconomic status, geographical areas? Do you have food-based dietary guidelines, or do you have a food guide? Do people follow them? Do you have an idea of what the current diet is? What differences are there between what they're doing and what you would hope that people would be doing for the diet of their own health and planetary health as well? What are the dietary recommendations? Is environmental sustainability something that you're interested in, or is it going to alienate your government if they're not working towards those metrics, those sorts of understandings of the political palatability of the method you might adopt here? What about income data? Do you have tables of median household income? How would you work out the income of families that are from low socioeconomic areas rather than just the median, and what welfare policies might be in place there? So, you know, I might stop there, Francis, and see if there's any questions. But thank you very much for the opportunity to provide that background and outline and highlight some of the challenges in collecting food price and affordability data, but also hopefully indicating some of the value in adopting this module. So I'm delighted that you're interested in this module, and I think your insights can really help shape and improve the methods and the approaches that we're using at the moment. So thank you very much.